As one of the 15 academic health science networks in England, we're here simply to spread innovation into the NHS. So we work with academics, we work with the industry, we work with NHS leaders in particular, and we understand what is needed to be inputted into the NHS to really solve some of the really thorny problems that we have in today's healthcare system. So today has been our annual conference, our Innovation, Improvement and Impact Conference, and it's always one of the highlights of our calendar, to be honest. It's bringing together everybody that we can from across our Yorkshire geography, and one of the fantastic things about being in the NHS is that you speak to so many different audiences, and today it all comes together. So we've got patients in the room, we've got clinicians in the room, we've got innovators in the room, we've got industry colleagues in the room, academics, we've got system leaders, and we've got national figures in the room, all talking about one thing, which is how does the NHS get better at the way it adopts innovation. The thematic conversation today has been really interesting because actually it doesn't matter if you're talking about an app or a change to a patient pathway or some kind of quality improvement intervention. Actually, there's the same kind of systematic barriers that exist for people trying to make changes to the way that we live and care for our patients. And innovators are doing the right things, and there's certainly pull from the system. People are desperate to change the way that we deliver care, but we've got to recognise the barriers that exist, and we've got to think about how does the AHSN start to break some of those down. So for me, the biggest impact today is to give people a really intense day about the opportunities that are out there. And we've had 10 of our NHS Innovation Accelerator Fellows, so people who are on a programme of 2 years of the NHS wrapping some support around them to make sure the innovations they have all produced are driven into the system as far as possible. We've had 10 of those fellows here today, this afternoon, giving an innovation carousel. So in effect, giving a really intensive, compelling, energetic pitch for their product. And the hope is that what people have heard here, the ability to take time out of their day job and to listen to those stories and to go back to the ranch and say, we need to do this and we need to do it now. And I now know the people to talk to who can come and help us to make it happen. So the future of the AHSN, I think, is really bright, actually. We spent the first 5 years establishing ourselves as part of the infrastructure, and I think we're now recognised as that convening function that is responsible for constantly driving this challenge about how do you do innovation and improvement into the system. So for us, it's really more of the same. But actually, what's really going to make this happen is if we start to get the system to recognise that innovation is everyone's business. And that's very much our passion. We can only do so much, but what we've got to do is give people the tools to be able to make these changes themselves. So for us, it's going to be an awful lot more of working with innovators. But it's going to be a lot more of working on the culture of the NHS in Yorkshire, finding frontline clinicians and frontline leaders who really get this, who are passionate about change, and just need that little bit of help to make a big difference.